Welcome back to Coast to Coast. I'm Lisa Spalla. Medical advances are bringing new hope to patients and families living with Alzheimer's disease, which affects nearly 7 million Americans, two-thirds of them women. Eli Lilly and Company is working to change the trajectory of Alzheimer's by educating on the signs and symptoms of the disease, the importance of timely and accurate diagnosis, and developing potential treatment options. Joining us now for more on this is Dr. Julia Schwartzbard, a neurologist who specializes in Alzheimer's disease research and treatment. Welcome, Dr. Schwartzbard. Thanks for being
Thank you.
here. First of all, what should people know about Alzheimer's disease, especially in the early symptomatic stages?
Sure. There's about 4.5 million people in the US with early Alzheimer's disease, and only half of them have been diagnosed. And it's because it can be tricky to make the diagnosis, right? How do we distinguish between the normal aging process, someone having a senior moment, versus someone who has early Alzheimer's disease? And sometimes it's very difficult to make the distinction, and that's why it's important to see your doctor. But there are cues and clues that you can become aware of. Like, for example, if someone is consistently repeating themselves or consistently forgetting conversations or regularly getting lost behind the wheel or misplacing personal items, those are all red flags and the suggestion that someone should really go ahead and see a doctor. Alzheimer's disease is caused by abnormal protein buildup in the brain, and one of the earlier abnormal proteins is called beta amyloid. And as it deposits in the brain, it causes these clumpy plaques, and these amyloid plaques are thought to cause the symptoms of Alzheimer's disease.
And why is it so important to recognize the symptoms in those early stages?
Well, first of all, we want these are our loved ones, right? These are our family members. We want them to be safe. So once a diagnosis is made early, we know that they need to be monitored. We can manage expectations. We can help with financial planning. And also, this is an exciting time in Alzheimer's research because there are medications now that are being tested and coming to market that may slow down the course of the disease. These are medications that attack amyloid, so they're anti-amyloid medications. They work best in earlier patients. So the earlier a patient is diagnosed, then the earlier you can consider whether one of these new medications is indicated for them.
Yeah, what's preventing some patients? I know it's scary, and then sometimes younger children might be scared to talk to their, parent about it. What's preventing patients from actually getting tested?
Yeah, you're right. It can be a difficult conversation, and what can even compound that difficulty is that some patients with early Alzheimer's lose insight. They lose their ability to understand that they have a problem. To outsiders, it may look like denial, but they truly are incapable of understanding that they're losing their memory. And that's why it's so important for those of us who love these people to make sure that they go ahead and get an evaluation. And then there's also structural barriers, right? Getting in to see your doctor, getting in to see the right specialist, making sure you're getting the proper diagnostic testing. All of these barriers need to be overcome so that patients can get an early diagnosis.
And getting that diagnosis, what role, does that treatment play on the disease? I mean, catching it early is key, kind of, right, for this?
Yes, exactly. Look, these anti-amyloid medications, the hope is that they will slow down the course of the disease, so patients will do better longer with regard to their memory and their functioning. Now, keep in mind that all medications have potential side effects, and these new medications are no different. There's a particular side effect called ARIA, A-R-I-A, amyloid-related imaging abnormality. It's generally a radiographic phenomenon, something that's seen on the MRI, but it can be symptomatic and it can be quite serious. So for someone who has that diagnosis of early Alzheimer's who's going to consider one of these medications, always important to consider the potential risk versus benefit when talking with your doctor.
There seems to be always new information, and you kind of mentioned that. Where can people get more information about everything having to do with the disease and treatment and the diagnostic stuff? Where can they go?
Well, first of all, go to your doctor, speak with your doctor. But if you want to go online, the Alzheimer's Association has a really wonderful website with all kinds of resources. It's alz.org, alz.org.
Great. Thank you so much. This is important information for all of our loved ones as, they get to a certain point in their life. So I appreciate you talking about this and being open to discussing it. And for more information, like Dr. Schwartzbard said, go to that website. And I appreciate you being here. And for Coast to Coast with Dr. Schwartzbard, I'm Lisa Spalla.